I'm Heidi Splete, reporting live from Digestive Disease Week in Chicago, Illinois.
I spoke with Dr. Geoffrey Nguyen of the University of Toronto about the association of methicillin-resistant Staph aureus with higher mortality rates among hospitalized patients with inflammatory bowel disease. What was your goal in conducting the study?
Well, we know that IBD patients, for many reasons, may have increased risk of certain types of infections. And there's recent data show that this infection, methicillin-resistant Staph, MRSA, also has very similar epidemiology to C. difficile, another type of infection commonly in patients. So we wanted to show and get some exploratory data to suggest, to look at the burden of MRSA in our hospitalized IBD patients. And if we can show that, then we can do future, more detailed studies to look at the reasons perhaps why they are increased risk of infection and perhaps looking at more detail about how it may, the mechanism for increased mortality in patients.
What are the implications for clinicians?
Well, I think the most important clinical implication is to try to reduce the spread of MRSA infections in all patients, not just necessarily IBD patients, because the mechanism of spread is likely the same within the hospital. And that the most important thing is then to really emphasize the infection control measures that are already in place in hospitals, and so I try to remind doctors to wash their hands after seeing patients, and then really isolating patients who have MRSA so they don't spread it to their other roommates.
For Global Medical News Network, I'm Heidi Splete.